Hi, I'm Dr. Stacy Huber, and I'm the owner of Animal Oasis of the Rockies Veterinary Hospital. Teeth are super important because they carry bacteria, and the bacteria can go to the organs. They can affect the kidneys, they can affect the liver and the heart, and so it's very important that we take care of our pet's teeth. As your pet comes to our hospital, we're going to check you in. You're going to go into an examination room, and one of our skilled technicians for the dental surgery is going to come in and go over the estimate with you, the procedure for the day. Dental procedures can be expensive, but it's well worth it. We want to make sure that we're taking care of your pet's teeth. We want them to live a long, healthy life. Then the pet is going to be dropped off. From there, the doctor's going to do a full examination just to make sure everything is great for the day. So that's why we're doing a dental today on you, huh? Because you got those gingivitis. And then once the full physical examination is done, we will calculate the medications and the drug dosages for the pre-anesthetic procedure. They will get an injection that will make them nice and sleepy. Good job. Good girl.
Yeah.
And then once they are sedated, they will get an IV catheter placed, and we will get them prepared for the dental procedure. Are you sleepy? Oh, yeah. Somebody's snoring already, huh? Then we will move to surgery, where we will then perform anesthesia. With the anesthesia, we do full monitoring and intubation, which does include putting a tube in their airway and supplying them with anesthesia and oxygenation. So we'll just pre-oxygenate her. The technician is solely in charge of monitoring your pet during the procedure to make sure that their oxygen levels are great. This is the part of the oral exam. We're just going to kind of look in her mouth or anything. Meanwhile, that technician is doing all of that monitoring. We do have another technician that is going to be doing full mouth dental x-rays. We are going to make sure that we see everything under the gum line. Good amount of tartar and gingivitis present, and trying to maintain that and get her teeth cleaned every year or two. Our dental technician is going to do a full mouth cleaning. We use an ultrasonic scaling. We scale the teeth, and then they also do a hand scaling to make sure we get all those fine little particles of dental tartar and plaque under the gum line, which can't be done without anesthesia. Dental disease is really important. A lot of times with pets, we don't really know what's going on inside their mouth. Oral disease can present as pain. Sometimes they don't really show pain. The ways that you can look to see if your pet has dental disease is one, look in the mouth and see if there's redness, sensitivity along the gum line. There could be some pain, there could be swelling, there can be an odor that's present. Pets don't necessarily let you know when they have oral pain or if there is a problem in their mouth with dental disease. But when they have oral pain and they're not showing it to you, it's important for you to have those routine checkups, and that way we can let you know at the hospital if there is something that's noticeable where your pet may need a dental. And then the doctor comes, takes a look at the dental x-rays and also the teeth, and makes a good evaluation as to what the next steps would be. Radiographs show right side, all teeth are intact, minimal bone loss. Mild pocket noted between the front two incisors. Then the doctor will perform any dental extractions that are needed. Yay! Okay, now we can flip. There we go, and we're going over. Checking your little oral cavity for any growths or any tumors under the tongue. The teeth are fully polished and then cleaned. Back to that nice white smile. She's got awesome teeth. And then the pet is woken up and recovered with beautiful white pearly teeth for you to go home with. Gonna be able to give good kisses? She says, I'm still sleeping. Once your pet is recovered from anesthesia, we're checking their body temperature, making sure they're nice and warm and ready to go home. The dental technician will give you guys a call and we'll go over all of the procedure with you.
Good, I'm calling because Estes woke up great from anesthesia, and I just wanted to go over some discharge instructions with you if you had a minute.
There will be a catheter that has been removed and a little bandage on their leg, so we do kind of go over everything that needs to happen once your pet goes home. Did so good. All right, time to take a nap. Turn the lights down, and time for sleepies. We do follow up the next day and call you to check in on your pet to make sure that they did well with the anesthesia procedure and if you have any additional questions. So we want your pet to have a healthy mouth and a great smile and go home and enjoy eating their treats and kibble without any pain. And we appreciate all of the care that you give your pet. Here at Animal Oasis of the Rockies, we want to do what we can to keep your pet happy and healthy.